Good afternoon, everyone. Today I'll take this lecture on pediatric surgery and anesthesia, right? So, though it we don't deal this very in depth, but you should have a superficial knowledge regarding surgeries and anesthesia. Means whenever anyone need advice from you, you have some knowledge about this topic. Okay. Basically, you need where you should know when to refer surgeon. At the end of this lecture, what we learn here: common pediatric surgical condition like a pediatric orthopedy, urology, and principle of pediatric anesthesia and post care and management, pain management. Okay. So before starting, you should know being a pediatrician, you should know the rule of what is emergency, what is non-emergency, right? So this line will be repeat so many times. So don't think this repetition. Okay, here. So whenever any child has a bilious vomiting, okay, bilious vomit, you should know what is bilious vomiting. What so first congenital deformity, surgical condition, it's esophageal atresia or with TAF on TAF. Okay, TAF, tachoesophageal fistula, right? So mainly first we'll deal with esophageal atresia. How esophageal atresia? So remember one thing: 80% of esophageal atresia is associated with tracheoesophageal fistula. So if you find esophageal atresia, you 80% of 80% of so basically see here esophagus and trachea. What happened is now see atresia of esophagus is taken place, right? Now this esophagus is connecting with trachea. Here, trachea, right? So this blind pouch and instead of continuing, it's continuing trachea, right here. So it's a fistula happened. You know, understanding is this. This is the 1 in 10,000 child is you can see. In my clinical setting, I gone through more than 20 cases still in 5 to 8 year of experience, right? Every year I can see a 6 to 10 this TEF during on and newborn.
If a newborn chokes while feeding, don't ignore it. Coughing, choking, or breathing trouble during feeds. This could be TEF, tracheoesophageal fistula. It's a condition where the food pipe and windpipe are abnormally connected. So milk goes into the lungs instead of the stomach. Signs include excessive saliva, feeding difficulty, and repeated coughing. This is a medical emergency and needs immediate attention. Treatment is surgery to correct the abnormal connection. With timely treatment, babies can fully recover. Share this video. You might save a newborn's life.
So it's the gross classification of TEF, right? See here, type A esophageal atresia with no associated TEF. See, this is trachea, this is esophagus, esophageal end in not combining with the trachea, right? So type A means esophageal atresia is there, but there is no fistula. So child will have a no abdominal distension in later stage, right? Now see the second type B. Type B is connected to the upper esophagus pulse with the lower esophagus in the atresia. You know, upper part of esophagus is connected and lower end is now management and complication, right? So how will you manage this child? It's like as early as you will refer to surgical, it's the outcome getting improved because child what happened here if you not refer early, child will land into metabolic acidosis, excessive frothing, and respiratory failure, right? Mainly respiratory failure. Now second surgical approach condition is like congenital diaphragmatic hernia. So congenital diaphragmatic hernia, right? So most common what happened here, most common congenital diaphragmatic hernia is left sided, which is also known as Bogdalic hernia. So anybody will tell it's anterior or posterior?
If a newborn can't breathe properly right after birth, act fast. Severe breathing difficulty is a major warning sign. This could be CDH, congenital diaphragmatic hernia. A hole in the diaphragm allows abdominal organs to move into the chest. This prevents the lungs from developing properly. Signs include breathing distress, bluish skin, and a scaphoid abdomen. This is a life-threatening emergency requiring immediate ICU care. Treatment involves surgery to repair the diaphragm, With early treatment, survival chances improve significantly. Share this. Awareness can save newborn lives.